Okay, thanks a lot. And thanks to our colleagues from Result and SAG for organizing this webinar, and to everyone who's joining in. My name is Marte. I am the Executive Director of APCASO, which is the regional civil society network of community-based and civil society organizations on health and social justice, including those working on HIV, TB, and malaria. And we do focus on advocacy and community capacity development. Just some introduction in terms of the webinar and the context why we're having this. We know that we cannot emphasize enough the importance of the TB Ministerial Conference that's happening this year in November from the 16th to the 17th in Russia. The conference aims to accelerate the implementation of the WHO and TB strategy, as well as the TB targets of the Sustainable Development Goals. The Ministerial Conference will also inform the high-level meeting that's happening, the UN high-level meeting happening in New York on TB in 2018. So this is going to be the first ever Ministerial Conference on TB, and it will see the participation of ministers of health and of finance from at least 56 of the most high-burden TB countries. There's a lot of stake in terms of setting of global frameworks and political commitments on TB, and our experience as communities and civil society who engage in similar spaces, high-level meetings and ministerial conference, we know how important it is to do groundwork before going into those meetings, even before those meetings get convened. There are a number of entry points and steps for civil society to engage, and one of them definitely is working with policymakers way before the ministerials. And as already mentioned, and as we already are aware of, I hope, this is exactly what the purpose of the webinar is, to surface guidance for community and civil society actors on how to engage policymakers ahead of the TB ministerial meeting in November. So just a quick overview of the program. We have a total of 1.5 hours. After this introduction session, we would have four speakers doing 10-minute presentations each, and then as already mentioned, we're going to pull all the questions towards the end of the program, where we would have a question and answer portion. So if, unless anyone would have anything to add, we could proceed with the presentations. We'll have first Denis Godlewski, who is going to share the latest updates with regards to Russian civil society preparations and engagement in relation to the conference. Quick information about Denis. Denis has AIDS Healthcare Foundation in Russia, and he's been working in the area of public health since 2007 when he joined ITPC and EECA. Denis, you have the mic.
Yes. Hello, everybody. Can you hear me well?
You're clear, Denis. Go ahead.
Thank you. I will introduce the brief update from the perspective of the Russian civil society, and it's brief, unfortunately, because at this moment the Russian Ministry of Health does not seem to be like super engaging into the process. At this moment, there are several activities happening. So first of all, from my side, I have coordinated my efforts and efforts of AHF in Russia with ITPC in Eastern Europe and Central Asia, and together we have approached the Ministry of Health, and the key contact person for this conference is the head of the department, one of the departments in Russian Ministry of Health. She informed us that currently there is one group that they are relying on, which is called TB People. And some of you may know the participants of this group from the Eastern European and Central Asian region. It's Timur Abdullayev, who is also involved in Stop TB Partnership. Also in this TB People group, there is a representation of all Ukrainian network and some activists from Latvia, Georgia, and other EECA countries. However, at this point, there is no specific plan on approaching or involving the civil society wide at the conference itself. However, what the head of the department mentioned is that there will be the one-day pre-conference in advance to the main conference itself, and they are open to discuss any practical suggestions, specific suggestions, or presentations to be included as the part of this conference. What we have currently agreed is that I will also involve into communication with the bigger group, the representatives of ITPC-RU. Some of you may know Sergei Golovin, who has been working in HCV field quite actively, and he will be the contact person from ITPC-RU side. And I'm going to initiate the communication with Mandy and with Lindsay and Erica from TB to make sure that everybody are in touch and are on the same page. I have to mention that, as I already said, so far there is not much engagement, and there is a concern from the side of the Ministry of Health on engagement of the civil society, because they don't want to make the conference and pre-conference to be the self-presentation of certain organizations, which is of course a nice excuse, because as you might know, the Russian ministry is not at this point, unfortunately, friendly and engaging to civil society in general in many cases. But I think in this practical case, if we do have some specific suggestions, and I know there is a discussion about 8 red lines and also the specific demands on R&D and other things, I think this can be communicated via ITPC and also via TB people group to the Ministry of Health, and this can be the key communication points from the civil society side here in Russia. And of course, further on, I'm also staying involved into the process, and we will be coordinating here on the ground together and look for detailed opportunities how we can be more engaged. And I'm also open for communication and being in touch and strategizing together. Thank you.
So much, Dennis. The situation at the moment doesn't look so encouraging, but there's still time. Hopefully, we'll be able to use part of the discussion to go into strategizing in terms of what support global TB civil society groups could lend our Russian colleagues to work around the situation and convincing Russian government to open up the space for civil society. Because again, like this would set the trend in terms of how the next high-level meeting and also the next ministerial meetings on TB, if there's ever going to be more, how they would run and how much space is open for civil society. And maybe again, we could also make as part of the discussion how if there's a little bit of opaqueness, not much transparency from Russian government to Russian civil society, if we could invoke the meeting being international, then opening it up to international civil society, just as a thought to flag. But we'll come back to that again later on. Thanks again. So now,
maybe one last thing to add, that also yesterday we spoke to Gottfried Hinschel from WHO, and we are also doing this twist to get involved through the WHO. And I will also communicate to Mandy the ideas that we discussed with Gottfried to make sure that the Russian groups and civil society reps are engaged through WHO. But with the WHO, you have to understand that the situation is that they do not have currently the official representative in Russia, because there was a promotion of the previous leader, and now they are appointing and going through the approval process for the person. So it will take some time, but there are some key contact people in WHO Europe to whom we should keep relying on in this situation. And we can do the check on the information that Gottfried has provided to me and make sure that we are approaching also the same people. Thank you.
Thanks, Dennis.
Hi, RD.
Yes.
I was wondering if there are anyone with questions that they can ask now before Dennis leaves.
Okay. Dennis, if you could just say, how many minutes do you have before you need to leave? So we'll have a gauge of how many questions to entertain. 10, 15?
15 minutes, and I apologize for this tight schedule.
All right. Okay. Any questions from the audience?
Please unmute yourself if you have a question that you want to ask.
Well, this is Mandy. I have a question for you, Dennis. I'm wondering, with the vacancy at the WHO in Russia, do you think that has been the reason that there hasn't been as much communication, or do you think it's a lack of engagement at the ministry level that is kind of filtering up?
It seems both ways. I think there is the problem on the WHO side on one hand, because with not having the person, officially appointed and, being constantly here in the country present and approaching regularly to the ministries being in Moscow, it's more difficult to have this appropriate level of discussion. But at the same time, I think also ministry right now has a lot of priorities, and I think it's also, the thing is that it's still several months to the conference. I think they are only starting to prioritize it now with the recent meetings that took place last week, to my knowledge.
Yeah, Dennis, I've got a question. Can you hear me?
Yes.
Yeah, you can. Yeah, David Bryden with Results in the U.S. Just a question from your perspective. How do you see the prospects for the Russia meeting being impactful and beneficial? Are you hopeful about this conference having some impact? Would it lead to, do you think, potentially greater commitments to real action by Russia or countries in the region? And I guess kind of related to that, at the pre-conference or other activities, do you expect that the Russian government would be, I guess, opposed to or take action to prevent sensitive issues being raised, like around injecting drug users, their vulnerability, or the needs of prisoners, those kinds of issues of social exclusion? Was that clear?
Dennis, I think you need to unmute yourself if you haven't yet.
Thank you. Hello? Hello?
Yes, go ahead.
Thank you for the question. When it comes more on the personal level, when it comes to expectations, I prefer don't have much of the expectations. But speaking of the goals, for Russia, it's always important to show some progress on the international level. And I think the recent, it might sound surprisingly, but I think the recent developments in the HIV field Have been slightly optimistic because what we do have is we do have the finally national strategy to fight HIV accepted and signed by the Prime Minister, and also there is the action plan on the attached to the strategy that was also accepted by the Prime Minister and signed on 27th, I think, of April. So through the link of TB and HIV, and also as TB and co-infections are the part of the HIV strategy and HIV action plan, I think like there is a perspective of getting some like specific results, both internationally, like get some commitments. Of course, we need to think on what and how specifically it can be demanded, and right now BRICS is still a part of the big interest from the Russian government on a geopolitical level. And if you look at the, for example, forums like St. Petersburg Economical Forum that took place last week, there was the big session where Putin and the Indian Prime Minister Modi was there. So BRICS is on the agenda, and going through that angle would be beneficial. And also on the national level, I think we could try to use this opportunity to ensure that there is a certain linkage and stronger interaction between TB and HIV services integration on the national level. However, what is important is that we need to have Russian NGOs coming with ideas, because in many cases, even the good ideas coming from the international NGOs will not be accepted right now. If something is coming from the level of ministries and will become from the different ministries like BRICS countries or other important allies for Russia, or countries like Argentina or somebody else, that's also likely to be considered as an opportunity. And also Russian NGOs need to come up with the ideas, and this is important. This is why it is important to support the local groups and provide them technical support to be capable to deliver this to the ministry. In terms of the specific issues, I think right now substitution treatment is a no-go, because once you can raise this question, but the answer is always the same, that currently legally it's banned in Russia, and there is no way we will introduce it in the nearest future. So, I mean, if it's important for some groups to keep it on their agenda and to keep it present, of course it's important to mention it, but I mean in terms of like hoping that by mentioning or raising the question of substitution treatment, it will have an effect. In my opinion, it will not. And moreover, it might undermine the other issues that you are raising. If you put like the list of 5 issues and one of them will be substitution treatment, there can be a problem in perception of the rest 4. So I think this is a sensitive question right now. In general, in terms of prisons and in terms of TB, I think right now also Russia is, and Ministry of Health is also saying a lot about the burden of the disease and the need to increase the standards and care and treatment. So I think in general, prisons and TB is the question that is discussed in Russia, so it's something that you can speak, raise, and that's important to do it.
Okay, thank you.
Can I? Yeah. This is.
Go ahead, Beatrice.
Yes, this is Beatrice Stickers from KNCV Tuberculosis Foundation. Dennis, very interesting to hear and get your perspectives. I just wanted to note that in recent weeks we have had quite good contact with Teresa Kasaeva from the Ministry of Health. Is that also your contact person?
Yes, she is the head of the department, one of the departments, and she is organizing the conference. Yes, she is one of the key persons, exactly.
Yes. I have found her in recent weeks. She is really very focused on the conference, and also very open to, she has also discussed with us ways to engage more solid representation from other Russian ministries. So we're working together with her on that. And also, yes, she has noted with civil society sort of, that the number of civil society engaged on TB is a bit low, but we also have an opening to work with her on that. So I just wanted to note that we are sensing a high priority on her side to work towards the success of the conference, and we are in open dialogue with her. Just to note that.
Mm-hmm. Thank you. Yes, that's exactly whom we approached, and the last conversation that ITPC also had with her was yesterday. So we were talking over the phone, and she said that she's interested in, having specific suggestions. That's what I mentioned in the beginning.
And what I wanted to reiterate is her stressing the multi-sectoral approach, so to use the conference also as a way of leveraging the social sectors and indeed also the Ministry of Internal Affairs and Justice towards the TB conference, which I think is important for the longer term.
Mm-hmm.
Thanks, Beatrice. Any other questions from the floor? If not, Dennis, do you want to say any final words before you leave?
No, thank you. Thank you very much for being engaged.
But I guess offline, there's a number of follow-up points that could be had, especially in terms of how groups are able to support Russian civil society colleagues to the extent that works in the Russian context. Either in terms of progressing work with your Minister of Health or strategizing to make sure that Russian civil society are not only consulted but do actually actively take part in the planning for the conference. We hope to see that happen. And perhaps Results and TAG could facilitate offline discussion, continue offline discussion with Russia.
Yeah. And can I just ask, Dennis, can we be in contact with you if we want to connect with more of on the ground civil society to follow your suggestion that that is the best entry point for having results on civil society representation?
Absolutely, and as I mentioned, I will be also sharing the contacts of the other civil society people through whom you also can outreach to the other groups.
Excellent. Will be very, very helpful as we work towards this.
Thanks, Dennis. Thanks, Beatrice. We now move on to the next presenter. This is Rahab Mwaniki, who is the Advocacy Manager at CAMCO, based in Nairobi, Kenya. Joyce will share her experience in Kenya on how to identify influential members of Parliament to engage them on TB advocacy.
I'm here also.
Okay. Please go ahead. You have 10 minutes. And please check to make sure that you're not on mute at the moment. At least I am not hearing you. Thank you.
Okay, hi, can you hear me?
Yes, you're clear.
Okay, thank you, thank you. I'm sorry for getting on the call late. The time just told me I should get a call in the next 30 minutes, but that's fine. So I just want to share a few examples, a few case studies of how CAMCO has been able to engage members of parliament here in Kenya to advocate for issues of TB and issues of domestic resources mobilization, like the Global Fund replenishment campaign. So how we do is that how we first got to get champions in the National Assembly is we wrote to the Speaker of the National Assembly to meet civil society, and we were specific that we needed to meet members from the Health Committee. And at that time, there was a need to discuss issues of TB in the country, issues of increase of resources for taking care of issues of purchases of drugs. And moving on is then during that one meeting, we then identified this member of parliament who was very active in the session, asking me questions and being open to say that we need civil society to support in getting facts, getting us facts, because they have limited staff to do analysis for all policy issues that may need attention in the National Assembly. Then we followed up by also, when you look at national television, you see some members of parliament are very active to ask questions related to health, and that's where we noticed the potential of Honorable Mullet being an ally of civil society. Later, we also engaged in on a face-to-face meeting, like on a need arise, like when we have issues, then we call upon him. We either meet him at the National Assembly grounds or we meet him in our office. And you may see that there's a photo there of civil society meeting members of parliament from the Health Committee. Again, how we cultivate their interest is that we write handwritten letters through the grassroots movement, which some of you may know. And this is an example of just one of the letters that was written in 2015 by a young grassroots advocate on the need for new TB treatments. Later on, you'll see how we've been able to also engage the policymakers on issues of drug in the country because of lack of supply at some point due to challenges with the system. We've also been able to have very close collaboration with the Ministry of Health and National TB Program Managers. On the photo there is the head of National AIDS and SADC Control Program and one of the deputy coordinators, deputy director, coordination and support for civil society from National AIDS Control Council. And what I'd say is there is importance in civil society getting to the National Technical Working Group, and that's when even people in the government get to see the potential we have and also engage us. It has come to a point where government officials have told us we cannot raise this within. Like if a government official has an issue, they cannot raise it within the system that they have an issue. They want an outsider, like a civil society, to ask a policy issue that is, of course, not to their level, but something higher than them, and to have worked to the benefit of the organization. For example, in 2015, the nutrition department was being downgraded to a department, and we were able to also write articles in the paper, and the cabinet secretary actually committed that this was not going to be downgraded. The other thing is civil society look out for local opportunity in the country. For example, the World TB Day commemoration. It is in this meeting that they are able to sell their ideas and push agendas according to what they see good for them, and also get platforms like at the national days to address key policymakers who attend those meetings, and also unique opportunities that come about. Like right now, we are looking at the Sustainable Development Goals meetings, which are very happening so much in Kenya, and I know in African countries, I know Kenya is also reporting this year, next month. We are also able to reach out to the Ministry of Foreign Affairs and Ministry of Finance. These are not early ministries. We usually do not have an entry point for them because they usually say they don't have a working mechanism for that. But what helps is also the one authority has to be proactive and know their issues very well, and the elevator talk. And this photo is when I met the Minister for Foreign Affairs in Kenya, Ambassador Amina Mohammed, at the Global Fund Replenishment Conference, where I indicated that civil society appreciates the work the government is doing, and also look forward to government committing more money for domestic resources for health in the country. And this has really worked because right now in the Global Fund, the country is committing $2.6 million US every year for the next 3 years as a counter-financing, because that's a requirement of Global Fund. So we've had a number of successes. We've had Kenya being the first country to have 133 members of parliament signing a Barcelona Declaration. We've also had Kenya being among the first countries to also form the national level TB caucuses. And the next, so let's go to the next. So again, we've also had, so we've also had the issue having members of parliament drawing to the national, because this is usually broadcast nationally, the focus on celebration of it on World TB Day, which is marked every 24th of March, and this has brought up, it has created awareness, and it has also hyped the issues of TB, because TB is not much hyped like in other countries. Next slide, please. Wow. Okay, so let me just go on. So the next slide is just signing of commitment by Honorable Mule, but the next slide is just section of the Hansard, and this was raised by a member of National Assembly, a member Honorable Shakir Ahmed of the Finance Committee, and the issue was issue of stockouts in Kenya. Kenya was going to experience stockouts, and we had just borrowed from Malawi. So the government of Malawi and government of Kenya had gotten into an agreement, but we're also hearing that this year in 2014, there was possibility of another stockout. And just to say that it's also important that civil society are able to document some of their successes. Every process, the process is as important as the result. Because when this happens, then civil society are able to know whether they did something very good or where they need to adjust in the future. But I want to say that in most cases, we found members of parliament being very willing to receive civil society, so long as their findings are factual and real, and they also they talk to the common man. The needs have to talk to the common man is not just about anything, because then members of parliament will actually look at issues of, they are looking at, if I do this, how are my constituents going to look at it? It's a matter of an issue being addressed and the vote they anticipate in the next coming year or something like that. So thank you so much. I think that's what I would want to share from here. And just say that I'm willing also to just engage civil society in the future on taking progress on such discussions.
Thanks so much. It's really appreciated your sharing of Kenya experiences, civil society experiences in terms of how to get buy-in and how to get support of your decision makers, or at least some of them. I guess for me, what I could get from what you just shared is that there's no hard and fast rule in terms of how to do that. But definitely there are strategies that could be tried and that could work. But the most important thing is being proactive in terms of looking for opportunities and in terms of creating. Sorry? Was somebody speaking? That was just background noise. So as I was saying, in terms of civil society being proactive in its approach in terms of looking for and creating opportunities to get the buy-in of their decision makers. What's tricky is that the experience that was shared is something that's at a national level. The difference with preparations for the ministerial meeting is that the meeting would happen in Russia, where we from the countries would have government representatives to be decided in the country to be sent into Russia. add to that the dynamics of our own, how do you call this, the missions in New York that would also be sitting in the meetings and deciding language of the documents that are to be drafted. So I guess it's important as part of our strategizing. Definitely work needs to happen. Preparation and advocacy by civil society needs to be happen, but we also have to figure out the map of how things would unfold, of how to determine where to find information of which parliamentarians or which ministers from our countries are actually going to engage, and also how to influence in terms of pushing supportive decision makers, government officials to actually engage in the TB Ministerial. I have one question for Rahab, and maybe we could just park this. This could be addressed later, just in terms of information as far as you know about Kenya civil society preparations and engagement with regards to the TB ministerial meeting. Because you've talked about experience in terms of domestic financing, which is well and good, but what do we actually know at the moment in terms of Kenyan civil society as well as government side of information in terms of the TB ministerial?
Okay, so we did reach out to the NCP manager at the time, who was Dr. Enos Masini, but has since moved to WHO. Then we reached out to the acting NCP manager, indicating our willingness to engage the TB program, to get to know what the country is planning. But you realize now that Kenya is going to election in the next 2 months. However, we are planning for a meeting for civil society to do issues of health sometime this month to discuss what we want to ask. It's good to know when we go to the cabinet secretary, though there may be changes after the elections, like what we want to ask, what will be our ask. So it's a tricky situation right now in Kenya. So we are going to have the discussion, then do an official letter to the cabinet secretary. We can only actively engage the office of the cabinet secretary after elections because there may be change of office bearer, but we are continuing to engage the NCP manager, the acting NCP manager. There are many issues we are pushing for. You realize that Kenya this year is when we launched the prevalence survey, the first time in Kenya, and there are many gaps realized in this because we have 40,000 people still not being traced who have TB in the health system. That's one. Two, TB is not getting the adequate attention it needs from the national and county level. And three, there's now a call for children, issues of addressing children between 0 to 14 years and adolescents because of the HIV co-infection issue. So we have many apps, but when the NCP just advised, we need to know what we want to ask and push for it. So we've not yet agreed on really the ask like 1, 2, 3, but that discussion will happen sometime this month before we go to the union conference.
Thanks. That information is much appreciated. I'm being quite a bad facilitator. We should have parked the questions towards the end, but that's fine because it's good to be mapping things that are happening at the country level, not only in terms of picture from the government, but in terms also of civil society mobilization. So thanks for that. We now move into the next presentation. So far, we've had 2 civil society speakers. Now we're moving quite at the other end of the spectrum with a speaker who is a member of parliament. Dr. Ruth Labode is a public health specialist and member of parliament in Zimbabwe. She is chairperson of the Parliamentary Portfolio Committee on Health and Child Care and co-chair of the Global Caucus of Parliamentarians Against TB for South African Development Community, SADC region. Dr. Labode is champion for the KP Rich Global Fund Initiative and is a member of the Global Fund CCM. She'll be talking about how to engage parliamentarians in the fight against TB, particularly sharing her experience as part of the Zimbabwean Parliament and the Global TB Caucus. Dr. Labode, please go ahead.
Hello. Thank you very much. Can you hear me?
Yes, we can hear you.
Thank you. I must say I'm grateful. I'm honored to be on this program. And just listening to the role of civil society, both in Kenya and Russia and probably Europe, I'm actually amazed. Because in Zimbabwe, one of the things I've discovered is that TB is a no-no for civil society in Zimbabwe. Right now, even as a parliament, before I even go towards how you engage with parliament, we have never as a parliament worked or gone to had interaction with any civil society. We work a lot on TB, but it's always, we have what we call the A team. That team is Challenge TB, who I think they are not civil society, they must be, we refer to them as a partner. We have WHO, we have the Union for TB, and then we have the network on the Global Network of Parliamentarians. It is a team, and then the Ministry of Health, of course, and the AIDS Council, the National AIDS Council. I don't know why TB is not attractive among the civil society in Zimbabwe. But for our engagement, really began, this parliament started in 2013. That's when we were sworn in. And then the 2014 report of the Committee on Health came out. It had one sentence on TB. It just said the TB is on increase. And there was so much about HIV, there was so much about sexual reproductive health. And then the report, it was the only report that media decided to take to publicize everywhere. And then the other actors, the union and others, woke up from sleep and came back to activate the parliament. So how do you engage the parliament? You have to remember, especially in Africa, but more so in the southern part of Africa, our constitutions have no limit on your educational background for you to become an MP, which means you could be 0 level to PhD. That mix of educational background is a challenge. So there was a need now. They called a small caucus meeting, I as a chair and the other MPs, and they said, what are your needs? We want you to appreciate that TB is on the rise. We said, we appreciate, but the parliament says, in your report, you must write about things you did in that year. For sure, we had done nothing on TB. We put it in the background. That's why we just mentioned that it's on the increase. And then, so we agreed. I told them that you have to increase the capacity. Members of parliament have to appreciate. It's not that they don't know that there's TB in the community, but because they're not comfortable, because they're not knowledgeable, so they don't want to talk about it. And immediately, the partners called a retreat where the Committee on Health and the Committee on HIV had 3 days. We went into group work, and it was amazing how members of parliament had so much knowledge. Some would come up and say, oh, my cousin did this, my cousin had that. I didn't realize that it could end up as a MDR, a mouth drug resistant TB, if I didn't make sure he went for treatment. It was really good. After that, we then moved the motion in parliament so that the rest of the parliamentarians could participate. And the debate also was very rich. From that time, we gave birth to the Global TB Caucus Network, because it is what is actually holding the advocates on TB in Zimbabwe and SADC. Because a lot of parliamentarians, we attend a lot of gender meetings. If you get to that gender meeting as a parliamentarian and you realize that they are not talking about TB, you then say to them, do you realize that TB has become almost like a KP, where the control of HIV is? Because if you don't do something about TB, the very HIV person you are trying to save or make sure they don't die will die, because their immunity is low. So we keep on actually throwing it in every forum, We are throwing it, whether it's sexual reproductive health rights for the youth, we throw it there, because if a youth is, we are claiming is a key population, if a prisoner is a key population because of HIV, so is he a key population for TB? Because he will die from TB. And then the Global Network invited parliamentarians to Cape Town in South Africa. And we visited their TB institutions, wonderful, and their research institutions. It was such a rich learning process for me personally. Even to hear that South Africa has got a study that says 80% of the deaths among the HIV or mortality was due to TB was a revelation for me. And I took that information back home. And I keep using it in Parliament, that we can put our goals and say by 2030, we would have done this and this, HIV with this and this, unless we also do something about TB. We're not getting there. We will not, because people die, mortality will continue. And then as an African countries, also we were lucky, an economist came up with a report and reported that if you don't have active case finding, and you end up with mouth drug resistant TB, Global Fund doesn't allocate a lot of money for that. Government will have to find the money. And this government are already struggling with the budgets for health. So the best solution is to ensure, that was the message to parliamentarians. You see, parliamentarians have a role of representation. They have constituencies where they address what is called meet the people sessions. And then we said, talk to people. Tell them that if you are coughing for 2 weeks, just say to yourself, I could have TB. Then seek treatment, because treatment is free. Thank God, courtesy of Global Fund. Investigation for TB is free in Zimbabwe, courtesy of the Global Fund also. So the only thing is the distances people have to walk, and lack of knowledge is what is killing us. So, you know, and then we have another role where we, as a parliament, we do an oversight on the Minister of Health. So we called the Minister of Health to our committee and interrogated him on why TB has become like a stigma, a disease that is not to be spoken about. I brought it to his, because you are now knowledgeable, we brought it to his attention that he has to acknowledge that TB and HIV are twins. While we have nurtured and looked after one twin and did so much, the other twin has come back very aggressively and is killing the other twin. So he has to tell us, he has to show us, demonstrate to us that he means business about ensuring that the National TB Program is actually sort of like promoted, given funding, allowed to move around. And then when we finished because these committee meetings where we interrogate ministers normally have both public and private media. So the story gets out very quickly into the press. And before we knew, there were journalists were telling us that they are willing to be writing articles on TB, that we must give it to them. And the National TB Program, who are actually direct under the minister, came to us and said, thank you for talking about us. It was like we do not exist, like we're almost leprous. By the way, leprous has been eradicated in Zimbabwe. It was like we do not exist. Nobody wanted to talk about us. You would almost think like if they came to our offices, they would catch this smoke of bacteria. So for me, to engage a parliamentarian, first of all, bring the appreciation, create that appreciation of the problem. And let's learn from the way we ran with HIV once upon a time. In Zimbabwe, for us to have achieved a prevalence of 13% coming from almost 35, we're now sitting somewhere on 13%. Of course, we do have these pockets that are problematic. I'm talking about HIV. There was a lot of effort, political willingness. MPs were tested, ministers, everybody, governors were forced to talk about HIV. And that's what we are now doing. We have retraced back our steps. Recently, about 3 weeks ago, there was an international trade fair in one of the towns. That trade fair attracts about 1 million visitors who just go through it. And that's huge in a population of 13 million. So we actually set up a huge outdoor, almost like a fun fair for TB, with pamphlets, areas for being tested, drama groups, people dancing. And suddenly people were asking questions. So they were saying, so this TB is still around. We thought we eradicated it. So we said, no, we didn't. It's just that we threw it under the carpet. But it has come out. It's now sitting right on top of the table. So for us to engage your parliament, get them to appreciate your problem, and also in countries like Africa where there's no money, ensure that there is funding for the training, there is funding for, you have to go with the parliamentarians when you're going. Like on the World TB Day, our partners will not go without the whole, at least 40 to 50 parliamentarians, so that the community during that time can talk to their members of parliament. Remember, they voted for them. There was something they believed they could do. And the parliamentarians are always thinking of tomorrow's vote. So they will definitely talk to the people, use the opportunity to sound knowledgeable. So give them that knowledge. And I must say, for me, I'm a champion for key populations, which is a global fund initiative. Really, when they meant key populations, they meant the transgender, they meant having sex with men, sex workers. But my first meeting I went to, I said to them, the mines are a key population for TB. Prisons are a key population for TB. Slums are a key population. Let us actually ensure that we deal with these things, because the very people are trying to protect may be killed by TB because they've gotten HIV. So I'm enjoying being an advocate for TB. And we're a big group in Parliament. After our committee was trained, through the global TB network, we created a network which went cut across other committees. And all these people play a role. If there's something, we distribute them differently to go to different places. Because they understand TB now, they are happy. They can talk about it. I hope I've answered something. I hope I didn't pass my 10 minutes.
Just by a minute. Thanks so much, Dr. Labode. We would come back to your presentation. It's just refreshing to witness and for you to give evidence to champions existing within parliamentarians in terms of TB and key population issues, and for others in the group to note the perspective coming from a parliamentarian in terms of how to engage policymakers in our issues and in championing the issues. I think your presentation is a good segue to the next one, which will be coming from Matt Oliver, who is the head of the Secretariat at the Global TB Caucus. Matt also helped found the network Global TB Caucus in October 2014. Prior to that, he was the policy advisor to the UK All-Party Parliamentary Group on Global TB that advocates to the UK government for greater investment in TB care and prevention. Matt has served as the director of the Project for Modern Democracy, which is a registered charity running a series of think tank initiatives, including Govern Up, focusing on civil service reform in the UK. Matt will be discussing how the people in the call in this webinar can utilize their country TB caucuses to mobilize policymakers ahead of the TB Ministerial Conference, and would share background information about the Global TB Caucus and the actions that people in this webinar can take. That?
Great, thank you. Just want to check that you can hear me.
We can.
Great, okay, cool. So a little bit intimidating trying to follow Ruth, so bear with me. I appreciate actually also that there are a lot of people on this call who've heard me talk about the caucus before, so I'm going to try and start in a slightly different place this time in the hope of keeping things interesting. And where I want to start is with the question on the next slide. So why do we work on TB? And I appreciate that it seems like a very big question, but for me it's a really important place to start because it informs the way that we all go about advocating for the disease. And I can't say what the answer is for each of you, but I would guess that, like me, you all have a couple of reasons, probably more, and one is quite simply that it's just unjust. You know, we can treat and cure this thing, and yet we often don't, and whether you get properly treated and whether you get ill in the first place is usually just a consequence of where you're born and bad luck. And so then when you take all of those individual injustices and sort of scale them up to the size of the TB epidemic, you know, we all feel that TB should be a stain on the conscience of the global community, and everybody should, you know, rally behind it as a sort of cause that everybody should act on. But we also all know that it's not, or at least it's not yet. If we could go to the next slide. I mean, we know that the case for action on TB is inarguable, you know, so far, from my perspective, the TB community has had a tendency to assume that everybody else sees it exactly the same way. And it's like we're on this particularly nice road and we've come up to a huge landslide, and we've been picking away at it with tools that are simply not up to the job. And for all the progress that we make, it just kind of seems insignificant against the size of the obstacle. And so, you know, we go to governments, we go to ministers, and we go to people who can kind of deploy heavier machinery, and we say, you know, will you help us? And they say, sure. And then we go away, and then we get surprised when nothing changes. And it's not that they don't recognize that TB is important. I'm sure they do. I think it's that we have never, or we haven't previously built sustained pressure on them to act. And so if we're going to get to this point, next slide please, the point where we have enough political support that some really proper machinery can be brought in to help us out, we need to think about doing things a little bit differently. And for me, that means we need to change how we operate. Generally speaking, we haven't been very methodical. Obviously, we've heard some examples on the webinar so far of very methodical campaigns, but in general, that hasn't been the rule. And until quite recently, we've tended to make one-off interventions. You know, we go to a country for a week for a meeting or event, we talk to some decision makers, and then we leave confident that now they know about TB, they'll take action. But you wouldn't change a health system by spending a week holding meetings or get policy changed. You wouldn't get R&D funding in 1 week. So I don't really understand why we seem to assume that this approach will work for building political will. Next slide, please. And so the caucus is trying to do things a little differently. We're trying to address the political failure by changing the mindset. First of all, we're trying to build capability. And by that, we mean creating ways that allow or make it easier for the community to build political will. And Ruth and some of the structures she's been talking about are a really good example of exactly that. Secondly, we need to drive accountability. So no more signings of meaningless governmental declarations. You know, there's no combination of words that will make governments act on TB. It's to do with the amount of pressure we can apply to them to stick to what they put their names to. Thirdly, we're internationally coordinated. TB doesn't respect national boundaries, so the response has to work across boundaries too. And then that fourth point, you know, there's, as much as I wish it were otherwise, there's never going to be a PEPFAR for TB. You know, the golden age of aid is probably over. So if we're going to fix TB, if we're going to end it, it's going to have to be the countries with the highest burdens who lead the way. Next slide, please. So what we built is the Global TB Caucus. This is a picture from the second summit that Ruth was talking about earlier. And if you look carefully, she's in there somewhere. And it also demonstrates kind of some of the things that we as the Secretariat do. So we engage and inform MPs, which is really important. We build networks and offer support, and we bring MPs together in these kind of meetings to strengthen their commitments and also to exchange ideas and best practices. But what we can't do in the long run is to provide the in-country day-to-day engagement that is needed to ensure that most MPs continue to work on TB. Ruth is a bit of an exception. And that those MPs are supported in working with their ministers and speakers and heads of state to apply pressure for change. The only people who can do that are the people who actually know what's going on in each country and who are a permanent presence, and that's civil society. So for the caucus to be successful, we want to help build civil society, or help civil society build relationships with their own parliamentarians, and then build partnerships with them to press governments for change. which is exactly what we're going to need to do for the Global Ministerial Conference and the high-level meeting, because as RD mentioned earlier, we need to influence governmental negotiation positions. Just having a position of civil society is not sufficient. So we need to work with allies like MPs who are particularly well situated to influence what those governmental positions are. Next slide, please. So here are a list of a few things that we can do to get started. And the slides will be shared so you can kind of look around these a little later. But actually the first step, and the one I want to kind of finish up with, is simply that we have to want to engage with parliamentarians and think of them as key allies. As a community, we need to think, I think, we need to think a little bit more about the political response that we're trying to create. It should be unacceptable to hold an event anywhere in the world on TB and not at least try to engage parliamentarians. You know, just a couple of months ago, a colleague wrote to me and said, you know, I'm at a big meeting of the TB community and everyone is saying politicians don't care and they don't want to engage. And I wrote back and asked them to speak to the organizer of the event and see if any local MPs were invited. And as you could perhaps guess, the answer, of course, was that no parliamentarians were invited. So how can we hope to get politicians to engage? How can we get political will if we don't invite them to meet us and hear what we have to say and engage in our meetings? So our hope is, just to really finish, that as soon as possible, the Global TB Caucus Secretariat is going to take a back seat. If we can move to the final slide. When we have proper political engagement, we can kind of clear off that roadblock and move forward at speed. But we're only going to get there through sustained, consistent efforts driven by in-country CSOs working in partnership, in a real partnership with committed parliamentarians who can help us press the government for action and for the change that we need to end TB. So I'm going to finish there, but just as a final offer, you know, the Caucus Secretariat exists to help make those relationships. So if you want to engage with parliamentarians in your country and you don't know how, we will help you do it. And we always have ideas for things you can do, so just get in touch. And I'm sure my details will be circulated along with all the other speakers later. Thank you.
Thank you so much, Matt, for the presentation, and I particularly like I guess, the picture of that sunset. I think at the end of the day, looking at the ministerial conference, we do have to find a way. One is to identify key points, pressure points, bottlenecks, key players to make it work, whatever we want to accomplish, the key messages and I guess language in the outcome document that is likely to be produced out of the TB Ministerial Conference, and therefore identify which gatekeepers, which key players would help us achieve that. And as you've mentioned, it takes a lot. It takes various players to accomplish that, including civil society, parliamentarians, UN partners. So we are now moving into what I hope is the more exciting part of this webinar, the question and answer. So far, we've had 4 presentations. We've had a minor Q&A just a while ago with Dennis because he needs to leave the program. But otherwise, I think we have about 25 minutes for questions from the floor. And I think Mandy would also walk us through any questions that have so far been typed as chats. So if anybody wants to raise a question, please unmute yourself and then speak up. Otherwise, you could also type your questions in the chat box.
Thus far, we don't have any questions in the chat box that haven't already been answered.
Okay, thanks. Anyone wants to throw a question to any of the speakers? Go ahead.
I have a question for Dr. Ruth. I'm wondering, as a policymaker, when you're approached about a topic, and there's many competing issues like education and economics and security. A lot of our countries are dealing with many different things. How do you convince a policymaker that it's worthwhile to do something on TB, and how do we make it easy for them to take action?
Where are you?
Dr. Ruth, did you hear the
Hello?
question? Yes?
Was it Dr. Me?
Yeah, the question was when there's many.
No, I heard the question. Was it to me?
Yeah.
Because you called me Dr. Ruth, and thanks anyway. Big challenge, I must say, because there are so many priorities, and you have so many different interests coming on your table. This is where you need to map out those parliamentarians with an interest. It's very important. If you came to our parliament, other than the traditional parliamentary committees, you'll find that there's a network of girl trafficking. There's a network on child marriages. Because there are certain people who have decided to work on that. As a chairperson, I'm forced to actually somehow still have a linkage with other areas, because I have to take a multi-sectoral approach to this. For example, I'm interested in housing because that affects a lot of other people. So it is a challenge, and especially when we are now deciding on a budget. But now we have developed what we call, when we are a pre-budget session with civil society. You don't have to be working in TB, just to decide that what do we say as a nation? What are the priorities? What needs to be tackled now, and when and how? Have I answered you?
Yes, thank you.
Any questions following up to that or on another topic? Can we request people to please mute themselves? There's some background noise coming through. Mute the participant.
I think everyone's going to mute.
So everyone has been muted. Is there any other question?
Yeah, so there was a couple questions in the chat box. One is, can you kindly offer us a timeline or milestones between now and the Moscow meeting? And is there something we should be doing in parallel to Moscow to prepare for the 2018 UN high-level meeting? So that might be a good question for Matt. And then Erica from TAG asked if each speaker could provide what 3 things they would suggest advocates do, either in their own country or at the global level in the lead up to the Ministerial Conference, to ensure concrete outcomes around funding commitments for TB programs and for research from that event.
Sure. So one of the things about the Ministerial Conference is that it obviously has to be considered in the narrative of the high-level meeting. Similarly, the G20 is part of that process, because no government is going to turn up at the high-level meeting who have already made commitments either through a G20 process or through the Moscow meeting and make a bunch of new and more ambitious requests. I mean, I might be slightly cynical in speaking specifically on the part of the UK government, but if there is, for example, a G20 agreement on R&D, they're going to get to New York and they're going to say, well, we've made this commitment on R&D, and we do the Global Fund. So that's us done. Over to you. So we really need to be careful thinking about how all of these things lock together to make sure that we don't undermine our own arguments. In terms of stepping stones, the WHO has, I think, published a kind of comprehensive chart of the way things are moving. But from a political perspective, the first thing that we need to do as quickly as possible is to get communications to health ministers, pressing them to actually attend in person. And then a follow-up to that would be perhaps identifying some key things from civil society's perspective to work on with those health ministers, because the agenda is broad, and if we want things to be really, if we want to make sure that it's a success from our perspectives, we need to make sure there is a lot of political support for the things that we consider to be most important. So I would say those two are the first steps, but for an actual timeline of events leading up to them, that will probably, I'd have to defer to the WHO on that.
Thanks, Matt. How about Dr. Labode and Rahab Moniki?
Well, three things that civil society needs to do is one, they have, and they need to just come together, civil society working on TB issues, to prioritize their ask for the TB, before the TB ministerial meeting. Two, they need to actively engage the NCP manager, and this is because these are the technical people. When a position paper for the country is being drawn, then these are the people who actually draw it, and it goes up the ladder. Then three, it's also good for them to do the intelligence, just find out who among the ministers is going. Maybe it may not be the minister for health, but it may be also another senior person, depending on how serious the government takes this meeting to be. And I think it's also good for them to do the issues like op-ed. It's good for them to do the issues on op-ed, put it in the paper, maybe even go on TV and say we are having this meeting and this is the agenda, all that. There's need for publicity also to be drawn. Yeah, so thanks.
Thank you, Dr. Labode.
It wasn't me.
No, I mean, next is you for a response.
Okay, thank you. Like everybody said, I really, I'm going to make sure that my minister goes to Moscow. Come rain, come sunshine. I've discussed this with him, and they said, as far as this is concerned, he is going. So that's very good. And then also, for me, what is also important is to keep the issue of TB on the political agenda. Already, I think cases of a lot of people who lobbied, the fact that the new funding model for the Global Fund specifically said a lot of sub-recipients need to, in their proposals, to have the combination of these two diseases. For me, that was a big thing. And as a CCM member, is to ensure that we are consistent with that. Because there's a tendency of, as I said, we have very few or one or two civil society organizations working in the area of TB. But I'm hoping that alone would move quite a few to look at the area, and by the time we go to Moscow, the civil society will support the ministers when they get there to ensure that the ministers articulate the right strategies or the countries, or also support the national TB programs. The other issue which I'm hoping is likely to happen is that we increase the number of parliamentarians, especially in Africa, that are now talking TB, or even in their motions or in the parliament. TB comes in as a topic and is debated, a motion is raised, is debated, recommendations are put, and something's followed. Thank you.
Thanks, Dr. Labode. So just in an attempt to summarize the responses so far, there's a number of steps that we could take as I guess as a community of civil society actors working with other stakeholders like parliamentarians. One is working at the country level and working with regional and global partners to make sure as much as we can that we lobby for as high-level political participation to the ministerial meeting as possible. Make sure that those who do make decisions in the country, who would go back to the country and implement whatever is discussed in Moscow, do attend the Moscow meeting. Second is in terms of clarity, in terms of civil society asks with regards the outcome declaration of the ministerial meeting. And this might entail preparatory processes at the country level, regional and global. And just to raise that there's a question around actually that, what key messages, what asks should we rally around, and that has to be developed. And this should build upon previous government commitments that we already have. But I wouldn't take away asking for things that are also ambitious that would push the envelope, because otherwise, what are we here for? I think there's also the importance, Dr. Ruth Labode has just mentioned the importance of longer-term, bigger investments in terms of processes, building the capacity of parliamentarians to make sure that they take on board TB issues as their own issue as parliamentarians, as caretakers of their citizens. And I would say that that also happens on the side of community. I mean, empowering and investing in communities so that they are able to advocate with parliamentarians. And I think a fourth one that we could add, and this couldn't be achieved at the level of a country advocacy, but working with allies, with SADC and others, is to make sure that the process that we come up with related to the Russia ministerial has clear, safe, and effective and respectful space for civil society. We cannot afford for this process to sideline civil society participation, for that to be the trend, because this is how it would roll out for the succeeding meetings that would follow, if there would be succeeding meetings, just for us to be conscious and to guard against that. With that, maybe we could, Mandy, you want to read through the rest of the questions in the chat box?
There's a few more.
One from Rico and a few from, please go ahead.
So Rika was wondering what kind of specific role communities can play in influencing policymakers and prepping them for the conference in their own countries, and what are the main messages that we can all commonly convey. So I think it would be great if we could hear from Matt and Rahab and Ruth on that. And then there's two other questions. Another is, how do we hold governments accountable to the promises they make in Moscow? And how would we make an accountability framework work? And are there examples from other health issues like HIV or nutrition? And then Grania asked, do we want to be asking other ministers to attend, as well as ministers of health, particularly ministers of finance, if we're asking for increased investments in TB, such as for programming and R&D? I can answer the last question. My understanding is that the Russian government and the WHO are providing funding for 2 representatives from each of the 56 most high-burden countries to attend. And I think they're pushing for the Minister of Health and the Minister of Finance. But in some cases, it might be the Minister of Health and the Minister of Justice, or the Minister of Finance and the Minister of Justice. So I think it's whoever the country decides to send along. But I also think it would be great to have internal pushes coming from people themselves to say, hey, who in my government's attending? I really want to make sure that the highest levels are represented.
Yeah.
So on Rico's point, yes, certainly. I think that we always need to remember that with everyone, it's not just politicians, that we need to kind of give a human reason and get it at the forefront of their minds. It can't just be statistics. We have a reliance on talking about big numbers, or some of us do, and so the people affected by the disease have a unique role to play. In terms of what can be done, we would love to see parliamentarians either convening or being invited to convene in-country hearings. in advance, whether that's a one-off event. And if the parliamentarians aren't willing to convene it, I would suggest civil society do it and invite the parliamentarians and the minister to have a discussion about all of these things and to make sure that the voices of people who've been affected by the disease are really at the forefront. In terms of main messages, I don't have a view yet. I don't know if there is a unified position across the TB community. How can we hold governments accountable? I think we can hold their feet to the fire in a way that we haven't done or been able to do before, because with the caucus, with parliamentarians like Ruth, the first thing that anybody who goes to Moscow is going to have on their desk when they come back is a request for a meeting from a bunch of MPs saying, we know exactly what you promised to do and we're going to harass you until you do it, or at the very least, give us a plan. Nick Herbert, the co-chair of the caucus, always likes to say that parliamentarians and politicians in general only respond to pain. And one of the problems, one of the weaknesses of the TB community is that we have never been able to generate enough pain for ministers to get them to do stuff. And in the nicest possible way, the members of the Global TB Caucus can be a fantastic pain. And I'm sure that they will be when Moscow is done and dusted.
Thank you.
Thanks, Matt. Dr. Labode, do you want to respond next?
I'll just add, all I can say is that after I received this webinar, I spoke to my minister. I told him that I'm going on a session where we are having a pre-Moscow discussion. And then he said, oh, that is very nice. So he said, can we now hold sometime in August a local stakeholder, meaning even other ministries, ordinary organizations, that even industry, because we tend to leave mining companies. We have platinum, we have big mines, but we don't bring them on fore to say you have a responsibility for your workers. So he said, maybe he's going to call a pre-Moscow session so that people tell him what is it he should take there. So that's what I'll be working on for around August. Hello? Hello?
Yes, thank you.
Thanks.
Rahab?
Yeah. So,
Do you want to respond to any of the questions, please?
Yeah, thanks. Okay, I would like to respond to the question on holding MPs accountable. I think it's just a misleading of being consistent. The official engagement needs to be in writing. Government has a way of doing this. So let's put the official letter of invitation in writing. We do, and they ask, and then in the meeting they'll say, we'll do this, and it up. I think that is what has made us in Kenya be able to hold our government accountable. And just to mention that in Kenya, we are also submitting in the course of next week a memorandum of 10-point plan of what Kenya civil society are asking for in the health sector, and TB is one of the issues because we need it to be politically accepted. We want, like the president, to say TB is an issue, we are going to tackle it the way they are being able to tackle issues of maternal child health and HIV. So it's good to put things in writing. It's good to follow up, and governments always listen, but like in Kenya, they don't like the way we go to the streets. So we also need to learn to read the mood of the government at the time. Right now, it may not be good to go on the street. You may need to do boardroom, but after election, it may be good to go on the street. So all possible ways can be looked at, depending on the time. So thanks.
Thank you. Mandy, or is it Waiswa? Do you want to make a short announcement? And I think you're muted. We cannot hear you.
Hi, sorry about that. I just want people who are on the captioning service to know that we have a stop at 9:30, so we won't be having text on that side of our webinar. And that's it. Thanks.
If there's any final questions for the speakers, please let us know, but there won't be any captioning.
Okay. Yeah. So we're reaching the end of the webinar. It's 8:30 right now in Bangkok. We've had 1.5 hours discussion. Before we end, I would pass the mic on to results colleagues just to close and to also give an indication of how we move forward for this, any documentation that we expect, and any closing announcement. But I guess just to respond to one of the questions that was Rico's, I don't know who at the global level is trying to map efforts and plans of civil society related to engagement with the Russian ministerial, but at least for Asia Pacific, APCASO, as host of the Activist Coalition on TB Asia Pacific, is trying to mobilize resources so that we could have a civil society preparatory meeting to prepare civil society engage effectively. We're saying there's a lot of preparations that have to be done, but it's a big assumption to say that country partners actually know how to navigate the space, where to start, who to approach, how to convene parliamentarians if needed to make sure that they do engage. So we'll come up with a process. We'll share this with everyone. We'll try to engage partners from the TB Caucus to be part of that process, but we do have plans and we're trying to come up with resources to pull that off for Asia Pacific. With that, I think I'll hand the mic again over to Mandy and to Weiswa for any closing remarks. Where do we go from here?
Thank you so much for joining, and we have everyone's information, your name and your email address, so we'll be keeping in touch in the weeks ahead, especially when the WHO has updated materials following STAG, the Strategic Technical Advisory Group meeting that's happening next week in Geneva. And we'll also be working closely with the Global TB Caucus on materials that people can use to engage their policymakers around the ministerial conference and high-level meeting, and have probably a more defined set of asks in the weeks ahead relating to coverage, universal health coverage and access, relating to financing for TB programs, and relating to investment in research and innovation. Those are the three areas that the ministerial conference aims to focus on. So we'll be sure to have some text for each of those asks that we can circulate, push the WHO to have, and then can be pushed at the country level. So really appreciate everyone joining, and if you have any questions, please let us know. We will be circulating the text and the recording of this webinar as well. So thank you so much to RD for moderating, and to all of our speakers. We really appreciate it. So thank you so much for joining.
Thanks, Mandy. Thanks, everyone. Good night.